Now, Hollywood Health and Society, the program within the Norman Lear Center, provides entertainment industry professionals with important information on health, sustainability, policy, etc., science, through giving them access to experts, giving them important information. So a writer can call us and we can help research a topic for them to ensure that their storyline is as accurate as possible. We also have a newsletter, and we do all kinds of other things to kind of keep writers informed. But I wanted to talk a little bit about the impact that television, particularly television I'm going to talk about, but this extends obviously to movies as well, and how the kind of impact that they can have on audiences' knowledge, attitudes, and even their behaviors. So this is a show, How to Get Away with Murder, a highly rated show. We worked with them on a storyline. They wanted to do a storyline about two characters who were going to take their relationship to the next level. One of the guys is kind of a player. He's been around the block a few times, and the other one is kind of a goody-goody. And the goody-goody says, well, we're not taking our relationship any further until we get tested for HIV first. The show came to us and said, okay, what would the nurse say? What would it look like in the hospital room? How would they get their test results? All of those kinds of information. We wanted to have it portrayed as accurately as possible because we know that audiences watch it and think, oh, if I want to go get tested for HIV, this is what it would be like. And that was the first ever storyline on PrEP in the United States on national television. So again, it was a great educational opportunity. So we saw a tweet from a health educator in New York who follows us, and he had gotten a text from one of his clients, and the text says down here in the bottom, I thought you'd appreciate this. Last night's episode of How to Get Away with Murder had an HIV testing scene. So this morning, I went down to the clinic to get tested, and I told the nurse that I was inspired by the show, and she said to me, you're the fifth guy this morning, and we've only been open an hour. So that's one clinic in New York City that immediately after the show, 5 people were already in the clinic, and those are the ones who said to somebody that they were inspired by the show. We worked with a show called Royal Pains, and Royal Pains is kind of a fluffy medical show. It's about a doctor who treats the very wealthy in the United States, but then he also does pro bono work for free, and it always has a happy ending, and it's kind of a light show. They wanted to do a storyline about a transgender young woman, and the actress is actually transgender in real life. But they came to us because they wanted to make sure that they were addressing the subject correctly, and there's some medical issues that she suffers, and so we wanted to work with them on that. But we thought this is a really great opportunity to look at how the effect of a show like this could have on this broad audience. And we found that viewing just that one episode of Royal Pains, their attitudes became more positive toward policies around transgender. At the time, there was all kinds of arguing about bathrooms in the United States. So other things that we do at Hollywood Health and Society is we do an annual award called the Sentinel Awards, where we honor television shows and movies that have had an effect on audiences' knowledge and attitudes around a number of topics, around health, around safety, around security, and other pro-social issues. About 5 years ago, we were given a grant by the Bill and Melinda Gates Foundation to take the work and the model of our work in the United States and bring it to Bollywood, to India. And in the last couple of years, thanks to the World Bank and to the Gates Foundation, we've been able to take our work to Mexico and to talk about what we do there. We were at the Morelia International Film Festival, where we did a couple of storytelling workshops and some panel discussions, and then went back to Mexico City with the World Bank later that year or the following year to present some of our work. So I feel like politically and sort of emotionally, things are at a point where people are really seeing the connection between entertainment and education, or entertainment and social change. And so I think those are some of the opportunities. The constraints, of course, are always money. And as I tell a lot of investors in our project, we're really a cheap date, because it's not that expensive. Just We're staff. It's just hiring staff and putting on an event here and there. But it's not, the cost to do an advertisement around a show like Grey's Anatomy or How to Get Away with Murder, for one 30-second commercial, it's going to be $500,000 minimum. And then, of course, a commercial around the Super Bowl or something like that, goes into the millions. Thank you very much.